Hello students, today we are discussing a very commonly used surgical instrument which is also very important as far as your exam is considered, your MCQ is considered, and in day-to-day surgical practice. Just see this, what is this instrument is. See that, one side flat, other side biflanged. See the, look at that. See that biflanged here, it is like this. Here it is flat on the opposite side. So what is this instrument is? It is Czerny's hernia retractor. It is a good old instrument, very useful instrument, used commonly in inguinal hernia surgery or other hernia surgery. Once you open the skin and deeper tissues, softer tissues, you can retract, and once you open the external oblique muscle, you can see the cord structure properly. Two blades will come like this. Between the blades, you can dissect cremaster, you can dissect sac, you can identify sac, cord dissection, separation of sac from the cord. All those things can be nicely done between the two blades once you apply this one. This instrument also used to do different places in abdominal surgery, skin, other surgeries, in incisions, deeper incisions, where the blades are very strong. You can hold it very nicely. Assistant can hold it very nicely. It won't get slipped off. It stays very nicely. So very good, useful instrument. This is Czerny's, basically hernia retractor. Look at the spelling. CZERNY, some places it called NEY, but it's actually CZERNY. So what are the features? Double side retractor, I already told. One opposite side biflanged, same side flat, as I shown in the figure. It is used in hernia surgery to retract layers and cord structures. Also used to retract soft tissues. Biflanged part allows dissection, biflanged like this, dissection in between the blades. So that is the very usefulness of this Czerny's hernia retractor. Remember, this instrument is very commonly kept in the Viva, in CBME syllabus in Oxy, and in MCQs also, and anywhere in quiz also they may put this one in projector and say what is this instrument, what are the uses. So in OT regularly you see this in basic surgeries also it is. So very useful manual retractor is Czerny's hernia retractor. How it is sterilized? By like other instruments, it is sterilized by autoclave, which is nothing but steam under pressure. So you can see, you can go through my clinical surgery, SRB's clinical surgery, current edition, which has got video lectures of all clinical examination, SRB's manual of surgery current edition, which also contains some lectures and everything in detail with the case discussion and online MCQs. And CBME, current CBME syllabus, it is accordingly it is finalized, and SRB surgical operation and text and atlas, and new thing, small book which is tissue approximation in detail with the video lectures, so that whoever practicing surgery skill you can learn with that book, 100 pages book, around 100 pages book. And you can go through my Diginor JP through JP publishers, even Diginor videos, everything is covered. Instrument, X-ray, specimens, operative surgery, few things about specialities, and everything as far as CBME syllabus is concerned. All lectures in detail is covered. It is also very, very useful, including clinical examination part. So students, I hope you have understood this instrument properly. Thank you very much.